So she's one of the sports specialists, and she's one of the Bangalorean, of course, though from Bihar. And she has been supporting Bangaloreans for a while now, and she's a incredible doctor with an incredible history of supporting all the various kinds of patients. So she is also supporting one of the blind community of cricket. So welcome, Dr. Richa Singh. Thank you for being on the show.
Thank you so much, Sean, for inviting me, and thank you so much for the introduction. Thank you. I'll go ahead with the things.
So I was just trying to know about the cricket community. I'm sorry, I think I missed on that. But
Yeah.
if you can just tell me the name of the group.
Like wheelchair cricket team India, and
Wheelchair
that's
cricket
what I
team.
work with. And they are like from different state and rural area. They are they are making a lot of teams already ready, state teams, and they do go to the different countries to perform their games and all. They are in many more activities too. So that's really highly motivating for the me also to work with them. And I feel really
Sure.
I got such opportunity.
Thank you. So I see you have won a lot of you have supported for blind
Wheelchair
sportsmanship as
cricket
well.
team and all. Yeah, yeah,
Yeah,
wheelchair.
and that is wonderful, just wonderful. So I would like to know more on those lines. Would you like to please share on those lines to our?
Yes, definitely. I do support a lot of para athletes in different segments and categories too. It's not about the wheelchair cricket only. And but yes, because physiotherapy is more of rehabilitation side first. They are the needy ones actually who
Right.
need differently able people and all. So that's what I had always because I do work in a metro city in a Bangalore West, but still I have that keen to work for them also same time. So that's what I
Hmm.
keep looking for such opportunities. That was the thing, and that's what I approached directly to the captain Somjit Singh of the wheelchair cricket team India. He's the captain, and he also asked the same question what you have asked. Like you are already practicing in Bangalore, then why you need this thing? So I told you this is
Yeah.
my passion, which I want to be, and that's what I can compromise on my regular routine, and definitely I would love to work with the team more of. So
Right.
that's the one thing I'll suggest you because physiotherapy is mainly for that. Obviously, first thinking comes in the layman's language. You can say for the differently able people and all this who need the support and more of better activity and all. So that's what I had. No, I want you to be work for them, and that motivates for me also. It's more than them. I get motivated to if I see them to be on field and everything. So that is very
Right.
different feeling because we nowadays we get stressed and a lot of thinking and we slow down with a very minor pain and aches also. So when I work with them, so I can motivate my other patients too. So that is like win-win situation. So that's the
Right.
thing. Yeah.
Wonderful. So how exactly it started? Like you got connected with these athletes who are into this.
True, true, definitely. So I remember if anybody comes in the normal my clinic, as in Bangalore, I'm practicing with small aches and pain. Also, they think of beyond. Okay, I don't want the crutches, I don't want the walker, I don't want the foot support or something. And when I see that team, they are like highly motivated, self-motivated people, and they have the want to do something different, and they want to showcase keep to the world and benchmark that what we can do. And what happened in India is still the accept the normal cricket team and everything all this wheelchair cricket team and blind cricket team and any other games also in all this category is not very much of supported well supported in the term of sponsor and the supports from the other segments too and they are the
Right.
needy ones. I believe that the country when they can work on that set of the population that because almost 2.5 percent of the Indian population is in that differently able category.
Right.
So government also definitely should support, but still as much as they are not getting support from the government in any sort of in term of education you can talk about or the services or the sponsor for the events and all. And this thing I believe should be get encouraged. That will help the government also in lot of different perspective too for their jobs and everything should be taken care and everything and support for the sports activities and all. So that way they showcase and in the field if you see the matches I have obviously I'm with them so I see the matches and they never feel like after with wheelchair also still they do not mind to be fallen when they're getting the catch or something that was they try to be and to get the run they have to management's batting also same time they have to run with the wheelchair. It's like a double burden for them. The whole body need to be really active, and which I believe for us normal population can't even imagine and think. So I believe that people at least should go and watch either on TV and live when what shows this thing. So that helps a lot to be in very different perspective to think that segment okay can do a lot of things. So it's so highly motivating for the normal population. So that's what I feel, to be work for them. This makes me feel like I'm doing something unique. Like, I'm, like, what you can say, you have satisfaction of your work. So that is like
Wow, wonderful. Thank you. Yeah, this is something very I think commendable, because it is something beyond I can actually comprehend, because the spirit is actually, I think, really
yeah,
unstoppable.
beyond
The
anybody can
right,
do.
yeah.
Yeah.
Right. So, has it ever happened as a sports doctor that you have to encourage them, or you have to somewhere, put them to a situation where, yeah, you can do it,
Uh,
or yeah, you have to
yes.
say that.
Yeah. So definitely, in term of definitely, I do take care of their injuries and all. They can be prepared for the thing. As you know, in sports is something more than the curative thing. Preventive thing is matters a lot. So they can perform better. Obviously, if the match you can understand, if one team is winning, one team definitely will losing. So and both are the obviously in the wheelchair best to this thing. So obviously, so one team is like, getting motivated to other team. But yeah, they are like quite good speed and all this thing. They do not feel defeated and all this thing, and they support each other and all. But yeah,
Yeah.
people sometimes with the injuries when they are lacking and they cannot play and they cannot get selected for the next match and all that definitely depress them. So definitely I work on that segment. So I prepare them in the off seasons also. So that will just help them to be perform better in that thing. So that's what helps them to be go ahead. So that is the only time when you guess sometimes they do get in depression if they're not getting the matches in the constantly. So that time definitely I have to support them.
So, do you ever feel that, it's like how much you would be able to manage your own personal things, or is there like a challenge where, you get overwhelmed with a lot of work on you, you know, like you have this also, you are a family person, and then you
Yeah,
have your own clinic. So, I
true.
mean, it's a lot if you see.
Correct. But I always have like you must be knowing I'm in ultra marathon too, and
Yeah.
I have noticed people start with 5K, 10K, then like 21. So it always you must have seen in that industry it happens that whoever 5K means I have done 5K, I have done 10K, that's fine. But if you somebody has done the 100K, so for 5K, 100K is too much. Fine,
Uh-huh.
but the who has done the 1,000 miles or 500 miles for them the 100K is nothing. So always if you want to see the work, everybody has whatever task, whatever level they are working, either men or women, anybody. So always this higher side is all about your mind, how you prepare yourself. So that's what I prepared. And time management, I organize myself very well, and I hand over the task which I do not need to be very look into, and the task which I really need to be, I take on the priority basis. So that's what I obviously planning out to do list definitely should be ready on that. So that helps me to be, and all the events and all I know in advance 2 3 months before only, and that was I planned to okay back to back I can wind up the things and all. So
Yeah.
that was,
So a
and
lot
that is
of.
for everybody that works. Yeah.
Yeah. No, I mean, of course, it's a planning, but to have so much of function going on, and it's like everything has to be in functioning. It's not like something is stagnant or something is wait, right? So wonderful. That's actually a wonderful thing. So, I would like to know from you that what inspired you to start running. I mean, did it came to you? You came to it, or how was
Uh,
it? What
so
what
for me,
exactly was
a
it?
lot of thing it happens that when you think of that perspective, you have zeal to be that direction to work. That always sometimes it comes to me many a time. Okay, so same thing happened to this event also because my patients whom I was treating and they were the ultra marathoners. Okay, and then I feel oh my god, I cannot and then I'm the type of person as definitely in a physiotherapy. So I know the pros and cons of the injuries and all very calculative this thing. So I do take a calculative risk and all these
Yeah.
things. And for me, running was definitely one thing is challenging yourself own body or physically active and this thing over there. And because time was for me was the definitely concern. I cannot take much of breaks and the leave the type of work what I have. So I do take in a year I have maximum in the running for me like 3 to 4 events. So I can manage. So everything, whatever I want to work, I have managed, I have planned. Not one thing is too much or other things should be get compromised. So that was I plan. And obviously the patients were the motivation for me here again. A lot of things I do and in my life has come through my, whom I treat and surround, you can say. So that was
Yeah.
it. And as you
Wonderful.
told, more work. So same
Wonderful.
thing. I have participated in, ultras. So just because I have seen people who are doing the 200 mile and 500 mile and all. So when some patients comes who has done the lesser than me, and then they ask you, okay, आपने ऐसा कितना करा है? Then I said, okay, I know the people who has done much more than me, so I'm nothing in front of them. So it comes to the work also same
Yeah.
way, and to the activity also same way. So that's the I manage.
Wow. Yeah. No, because I see your pictures as, like someone who is grass and having a lot of, pots on your head. And, a doctor, a person who has her own clinic and everything. And I mean, in a way, you don't have to do that. But I mean, to not take pride to it and just enjoying your own culture and living to the
Correct.
fullest is something. I mean, I would love to know how that came up. How exactly is, how do you find that motivation?
For me, actually, I born and brought up in a, you can say, rural area in Bihar, in a village. And there was not, the girl child was not very much of this thing, acceptance from the family and all. And that is, but it didn't bother me since beginning, actually, whatever, after, like, first birthday and all. I asked my mom after a few years when I was in school, ma'am, when is my birthday? My mother told that not in our family, we don't have that culture to celebrate the birthday, because she doesn't wanted me to answer that, okay, because you're a girl child, is not going to be happen for you. So she has just modified the sentence and told. Later on, I understood when I was in standard fifth, sixth that, because I'm the girl child, so that's what nobody celebration in the family and all. So because joint family, it was if one person will start, everybody will question and all this thing. But this was the very general thing and all. The same has come for the education. But I was like my culture in terms of everything else, except this was the one thing, because education and all. I believe, and this was not their fault also, because if you read or study something, and since ages is coming through the family, it's difficult to suddenly to change that pattern. Somebody has to
Yeah,
remove
it's
that
a
patience. And
conditioning.
also what happened, I have noticed when I was in standard fifth six, only few cousins, my my sisters, sisters, they wanted to do study. And also there was and then they little bit of became aggressive with the nature and all the things. And then they finally they look, okay, tera padhai likhai ho gaya, let's get married and go. So I don't know that the scenarios. I understood in the family that, if I'll go something with, pride and all the things, not going to happen. So I have to have patience. So that's what, from, you can say, from sixth, seventh standard only, I have planning to be how to, as soon as possible, I can leave from this place. Then I noticed my parents can only the medical industry, they are ready to send, or else no. I was the person to take whatever you want me to, I'll do, just to escape this place. So that was my aim, was not to be become medicine or something. Whatever you say, I just wanted to escape from the place. That only I can prove the I need this thing. Otherwise, theoretical, they were not
Yeah.
ready to understand the fact. Then I got the opportunity and came to Bangalore, and then the things has been, obviously, they got to know what is the value of the education and everything, and that has. But yeah, I love my culture. I
Yeah.
do miss village culture because it's totally different and very much. We don't need anything like over there. Everything is easily available. No tension of
Yeah.
the bill payment and everything. The food, whatever you want, no wait for the online or anything and all. Everything is available in the house. So that's very different feeling. Like, it's like
Wonderful.
a stress level is too less, I believe. And totally. So I do enjoy this
Yeah.
culture
Of
a
course.
lot. So I do miss the going to the well and having the water over there and all. It's great to me.
Yeah. No, I saw you do with the pump,
Yeah.
pressing the pump
And
and,
oh, chule ka
taking care
khana
of the
and all that
water
I do
and
miss.
everything.
I'm not the great cook, but yeah, I do take opportunity whenever I go. So even people do get shocked in my village also, whoever haven't seen, because I go after a very long gap nowadays. After 10 years of gap, recently I went over there. So they were shocked, since 10 years we have never seen you. And do you know to make chapati? And they were surprised. I'm like, yes, I know. So elderly population, they have told them, yeah, she knows everything. It's just that her. So it's always we have mindset. If one set of the things you're doing might be not knowing, but I have taken everything to be as a learning. So cooking is everything as a learning. So whenever you don't need to be hungry if you know the cooking. So that was the reason. It's not about the money all the time. It's about knowing the skill also. So everything was a skill. So that's what I learned in
Yes.
village culture.
Yeah.
That's it.
Wonderful. So do you ever feel that if you ever get a chance and you are like you have enough and everything, you would like to go back and settle
Yeah,
down,
definitely,
go
definitely.
back
Village,
home?
with the first choice will be my village, to be, or any village. It's not about my
Wow.
own this thing. Any rural area, I'm ready to be settled down. It's like that thing. That's the thing. Yeah.
Wonderful. That's wonderful to hear. So, coming to running, because that's what we as I being a runner and being a vegan runner, I would love to know a little more on those lines from you. So firstly, I would love to know that being into sports for a while, and like there are a lot of injuries which keeps coming to you, and which are very so often that you realize that why did I even
Yeah,
start?
correct, correct.
Sometimes you just feel like giving it up. So, for people like who want to stay consistent and they still want to perform in a sense that what I was in 2020, I don't want to be in 2021. What are the few things as a runner we can keep
Should
up
we
with?
go ahead with
As in, like being consistent. Yeah. What do you
one
think
thing is
so?
very simple sentences. In one sentence, the answer is in listen to your body. Okay, so when you are in running or any activity, you know when your body is giving the alarm, first of all. And second thing, preventive measure is more important than the curative. And so do not wait for the injury. If you have some events, prior to that only prepare for that thing. Is your body is ready or no? So do keep in touch with any sports physio to be whomsoever nearby and all that. You can go ahead with any runners I'm telling about. So that's what that person can tell you the where your body is living and how much and all these things, like how the any seeing the car, how much the mileage and everything engine will go, and long drive you can manage or no. So that's it. So same way physios have that knowledge of the body, so they can tell you your vehicle can go to the long mileage, how much mileage it will give and all these things. And plus another
Yeah, of
uncertainty is
course.
different thing. You didn't get the proper the what you say run like all the places and all where you're going to be hilly area you going, or the track what sort of track, or is it where running you doing and all those things. Definitely your other assets and gadgets also matters, but yeah, same time if you understand your body and little bit of alignment correction and all that, the most important part I'll say, enjoy the body. And if you're enjoying the activity, you'll have the lesser injury. If you'll have the fear of the injury, you'll have the more injury. One thing is that. Something is overthinking also do, because if you're stressed out before the event, okay, I have to run this much, then you'll get mentally fatigued first, and then the body won't support you. So mental fatigueness, you have to be controlled a lot. Then only body will support you. So these are the things definitely. And monthly once, if somebody is regular runner and practicing, definitely should keep, so body will be ready. Another thing is monthly definitely visit for the deep tissue massage or sports massage, you can say. So whichever area is not necessary each and every muscles get fatigue or each and every muscles get weakened, we can have a track of, so it will keep offloading the muscle tension. That will give your body better support, so injury can prevent much more better way. So these are the things you can go ahead.
Yeah. Wonderful. Yeah. So, what is, as per a physio, I would say that what is the importance of warm up?
Definitely, warm up is much more important. Any activity when you do, body need to be get into that. If you say somebody goes to the even hilly area and all running, they say ki go or temperature is much low some area where like normal this thing. So they say ki go in advance only. It's 48 hours it takes to adapt to the environment and all. So these are things very much of important for the body for anything. So
Yeah.
same way,
Yeah.
warm up is also get in the rhythm, body gets in the rhythm, and then gradually you can go ahead with the running. And same way, cool down is also important. Post running stretching is also equally important,
Yeah.
and then 2 days recovery time. Always give the time to be next 2 days to be ease out, and then put anything and all. Do not go too aggressive also with the body, and don't go too ease out also with the body. So that we see very much calculative. You have to
Right.
understand your own body based on that. Most of the time what happens, patients who comes to us with the injury or before the injury also, you can say, uh, so they do not listen the what doctor is saying. They have always ki usko aisa hua tha. So it's like it's his body or her body. You don't compare your body. Why you will get the ACL and all, your ACL is different to the other thing. So never ever compare your own body to the anyone else. Understanding and knowing that injuries is different perspective in terms of the knowledge, but feeling the same pain and the injury getting going to happen to your body is very different depressive perspective. So as a sporty nature, I suggest always should be move on much more positive side. That helps to ease out the body.
Sure. So would like to also know that when it comes to physio especially, and I see a lot of runners having a perspective where they say that physio is a kind of getting into money making. and they have this opinion coming up where I see that they will tell you first this disease or this injury, and then they will tell you this injury, then this injury. So it's like they try and create you with a vicious circle that you end up going to the clinic. So, what is your thought on those lines? And when someone comes up with that kind of opinion, or I would say situation, what do you
So one thing,
have to
as
say
they
on
told,
those
ki money
lines?
minting industry or something. So that tells you what you're getting free in anywhere. What are you getting free? Whatever you avail, anything, either love affection or whatever you expect,
Yeah,
everything costs you, right? And directly or indirectly, but it does cost. So same way here also. So what happened? This is as a novel industry. That is because healthcare industry is always, it happens. It comes to the like no money term, because health, we have grew up in such environment in India. It was, there was no preventive care. Now it has become, no one will bother also give BP sugar. Earlier BP sugar, oh my god, oh somebody got BP, somebody got sugar, like that was it in family. 1 or 2% used to be. Now like every third person, I believe, like in the family, the
yeah.
diabetes.
It's like very common that even a 20
Correct.
year old, 30-year-old will have a heart
True.
disease or anything. So now I would like to, I mean, since I have been a vegan, I would say that one of the thing I have enjoyed of being a vegan is the inflammation part. And so, do you have anything to suggest for our listeners who would like to go for vegan, or is it something they can go with, or how exactly as per your suggestion, what is ideal on
Correct.
those
So,
lines?
as in running or any activity, only a physio part or injury is not the only thing. As your food habits, your routine, your stress, other stress, also everything causes to the body. Body do take a toll of each and everything. But yes, interesting. You do not get pain when you do running, post running, because muscles are more functional and active, so that gets the pain. So you, after running, it has happened.
Yeah,
So I always say, do not blame the incidences. Blame your body was not ready for that activity. No one understand this perspective. So when the person will start understanding this perspective, your body should be ready, then you won't have the pain, injury, and all those things. You're not making it ready. In terms of that, it comes to your food habits
yeah,
also, the type of food what you're taking and the routine. Whenever that your event was there, how prepared you were for that event and that day, whatever your other mental this thing conditions and all. Something can happen. Right? You are not mentally prepared at that time, but you have to participate because the event has come. Good this thing to all do this thing, counts on the body that time. And inflammation part, as I told you, icing is very important. And that preventive measure will help a lot this thing. And post running, obviously the soreness is quite common, so icing will help, and the stretches helps at the initial stage. Wait for 48 hours. If nothing is the pain bothering, like 1-2 level of the pain is that fine. But more than 50%, if you feel like still is not recovering after any particular muscle or group, then definitely you should visit a physio or somebody to be like take care of that part. But yeah, first initially do not rush
yeah,
immediately. Till the time is not something kind of ligament injury or something you cannot walk or stand at all. That is different thing. But understand the difference of the soreness and pain is very much of important. Many people doesn't understand the difference between the pain and the soreness. Pain is the pain is like can lead to the injury, but soreness is like fatigueness. Post running, obviously everybody will have the fatigueness. So give some time. So not to
yeah,
rush to the thing. But
yeah.
now everybody is impatient. They start googling and all this, go through all the diseases. So before they enter the any physio or the orthos cabin, only they come with their own diagnosis. Doctor, I think I have the tendo Achilles or I have the ACL injury. So they only get to know without doing MRI and everything they have the ACL injury, just reading the symptoms. So that it happens. So that's the thing.
So, is it fair for a doctor to get such kind of a client? That hesitation to handle that kind of a
Not really, but
patient.
sometimes it becomes to the overthinking. I know many runners who are doing really great, and 500 miles plus they are running, and in a year many events, but they never ever require the treatment. They are in good term with me and all the things. They are in touch, but they don't need any preventive side. Their mindset is so strong that they don't. They are not stubborn. Also, same time I'll say it's not a stubborn behavior that I don't visit the doctor or physio. It's nothing like that. But yeah, their body is prepared for that one. So they have trained their own body in
Yeah,
such a way they don't need such this thing. Not necessarily that every runner needs a physio or
consultation.
any
Yeah,
support, not at all. So if you're not ready, then obviously you're visiting. So physio is not going to the patient. Patient is coming to the physio. Understand that difference. Obviously, if you have come with the problem, obviously you have to pay something for that one and then get to know the figure it out the reason. So
yeah.
about the mindset.
Surely.
The same shirt or whatever the clothes we buy in 500 and 5K. So that totally depend upon the same restaurant food. Same dish you can get in the 50 rupees and the 500. So that is the difference is there. You cannot say that 50 rupees idli and the 500 rupees idli has, you cannot compare the place. You cannot ask the 500 place where you gain and then you're asking, that in 50 rupees only to get that taste. So same happens to the physiotherapy also. It's a service. So based on that, what they serving, the what they like spending on that one, so that is cost varies and demand and the requirement. So
Yeah.
obviously it will go. So
Yeah. So tell us about Perfect Bounce, how exactly Perfect Bounce started. I mean, why did you take up a decision of putting it all together on your own? And, it's a responsibility. So how was a situation at home? How was it,
yeah,
everything like
everything is
that?
like for me, you can say almost balanced. 10% always goes here and there. So that is I'm always ready for that one. Okay, I handle okay. Mentally prepare. We have to be. We cannot be 100% perfect for each and everything. So that here and there something it happens.
Yeah.
So that is fine. But yes, for me is like level up is important. One thing is I get bored with the same thing, and that's what I always to be next look for that one. One thing was that, and as per the perfect bounce, what I felt this has come in my mind because of the type of patient I was handling. I was seeing they getting lack in the term of the food nutrition. Sometimes they do not know alignment about the alignment of the body. Sometimes the why the injury, and they keep running here and there and conclude. So this is like under one roof only you can get each and everything in terms of the pain management or the sports. We have both the thing. We have the facility for the diet consultation to the nutrition. That we also as well as category we keep it. It's not for everybody and everyone required. Who's required. So that will be suggest and your choices. You can go ahead because as I told you running or any other thing pain management also normal both the things works on the all the five factors you can know that five elements of the body that works so same way I always suggest them to go in that direction so their routine and lifestyle obviously I try to be modified as much time and I do take care of the counseling part too not even me my other colleagues also staff over here who all are there everybody so all matter sometimes pain enters the mind more than the body I do believe in that
Yeah.
and that I try to rectify and that was I see like no body I don't need too much work with them if I take out the pain from their mind body starts recovering much more faster than anything else so that always most of the
Absolutely.
cases it happens so especially who takes about who is saying like no since 5 year 10 year I have pain so nothing can hold in the body so longer pain is like more of emotional feeling so as you come out of that aura in whatever the term of the incidences can happen to the thing and we cannot control a lot of incidences so the same thing happens to the patients also and that one particular area they keep getting the pain again and again recurrence happens to because that has become quite weak area of the whole body and then okay no it's because of MRI किया कराया था मैंने ये कराई surgeon को मिला उस doctor को मिला and still I'm not recovering so then I start, working more on the counseling part and they recover. So I believe it's for the skill and technique, how you portray it, like presentation matters a lot. Everything. So that
Absolutely.
present completely
Absolutely.
better way
Wonderful.
than anything else. That's the only difference.
Sure. So yeah, so I mean to almost getting closer, so I would love to know that any three things which you are feeling blessed about, like you feel that you are really grateful.
Yeah, a lot of things I can say. First of all, I feel blessed that I got education. That was the asset for me of life until that I can say. That was the thing
Yeah.
which even my mom didn't thought of her dream was मेरी लड़की 10th pass कर जाए, matric pass कर जाए. That was her dream. So when I born, that was her dream. So and what I have wherever I am. So she's too proud of me. This thing is worth it of what because obviously she had suffered little because of all these things. So obviously for every mother, like the girl child is much more other thing affected. And she was knowing that my brother will get a good life and all this thing, but she was concerned about me, so I got better. So she's happy for that one bit. One thing is that, and second thing, wherever I am in terms of my work and all, I have highly satisfied to the work. But same time, wherever I reach, I see myself as on a scratch level. So I always have next thing to learn and to do. So that is the one thing gives me to okay finalize the thing and offload my task and wind up and next to me. So I keep taking a lot of projects parallelly I work and see which is like I'm done with. I'm no more of much I have to be add on my learning or anything or value that I goes and I hand over to the other person and then I switch to the next one. So that's the thing. So what happens?
Wow.
The confusion in whoever knows me and they watch my work and all the segments, so they get confused. Ki which so they start taking a competitor in that industry, and then they say suddenly she is no more in like competition, and so they think like they have defeat me or something, and they don't know actually I wanted to go that much of distance only and come back. So I plan accordingly in each and every segment how much I have to go and come back. So that's one thing I believe that quite differently I work on. And third thing, I believe my support system is really great in terms of the patients and my friends and who were all the who know me. And a few opportunities I get like recently also whatever. So I made them hardly very few minutes. I can say even I think with you also, it's not too much of meeting and all, but still you felt like putting my work. So same thing happens with many time in my life, and I don't even remember somebody whom I met and then suddenly they only recommend my name for some good work or something. Okay, she is this. So these are the thing opportunities. It comes for me like sometimes as it's a blessing that 5 10 minutes also I meet
Yeah.
somebody and they keep watching my work and then they give me the opportunity for this thing. So I have never run. And same thing happened to my awards also. So I was never to be in that was
Yeah.
because patients was giving me the feedback and okay, they are getting pain relief. So that was giving me the satisfaction. And I am the type of person who was if I'm not able to relieve somebody's pain, I get the anxiety and I do not get my sleep. Because that much I wait for the patient's
Wow.
reply or something. I tell them, okay, you can text. And so that was so for that, I met the counselor once. Okay, so then she told you're too much into your work, so try to be offload that. So I carry my treatment tools, I can say, as a makeup kit, bigger girl, So instead of makeup kit, I carry that one. And anytime I'm ready to be like many times I got opportunity to treat somebody in the airports also, and I never miss that. I feel wow,
Wow.
like I got the opportunity. I take it as a blessings to me. I can help somebody come out of the pain.
Yeah.
So that's the one thing which drives.
Kudos. Many kudos to you for that. Seriously, lot of respect. So, I just, with the final thing, I would love to know any one book you would say that you would love to go back. Any book
Yeah,
for that.
I read a lot actually, and more of I read about the pain management a lot. So one book is I'll say Biology of Belief. I don't think one life will be enough to learn and read the things, and implementation is important. It's
Yes.
not about reading only. Many people I have noticed. I have come across few people who tell I'm in the spiritualism and all the things I do, blah blah. So, but when you talk to them, you will have the lose the trust on the spirituality. Actually, that negative they are. So
Yes.
that also do come
I get
across,
what
and
you're
I can
saying.
feel, you'll believe, no one will start following that thing. So yeah, but few of my patients do make me feel like okay, I should read this book or do this such routine or something. I do learn a lot from. So each and every time I try to, learn that visit helps me a lot.
Wonderful, wonderful. So, yeah, with that, I would say thank you so very much, Dr. Richard, for coming on the show and making it such a wonderful and a delight conversation. So, yeah, I wish you all the very best. And those who have never visited and are in pain or any kind of a consultation, I would definitely let them go to Perfect Bounds. It's a right place, and let's just get the recovery done. We have our pain pain free doctor. They can definitely let you out of pain.